Thank you, Chrissy. Today we're reporting no new cases of COVID-19. Congratulations to all of you. There's nothing like a zero on a Friday. So that means we currently have 9 active cases in our province. That is very good news. We're doing well, but we can't take COVID for granted. We've seen in some of our sister provinces what happens when COVID takes hold, and it doesn't take long. I'm also happy to say that we're starting to roll out the vaccine, and it is starting to ramp up. Public Health has administered over 22,000 doses, with 7,500 Nova Scotians fully vaccinated, and we're making a dent in our long-term care facilities. I want to thank Public Health and all of the teams that are out there administering the vaccine. And I want to thank Nova Scotians for your patience. Supply continues to come in. And Dr. Strang, I will now turn it over to you to have more detail.
Thank you, Premier. Good afternoon, everybody. Yes, it's another good day in Nova Scotia. We report no new cases and only 9 active cases. Everybody's hard work continues to pay off, and this is good news. However, I'll emphasize what the Premier said. We cannot stress enough that it now is not the time that we can become complacent. Only yesterday, Newfoundland reported their largest single-day increase since COVID-19 arrived, 100 cases, and they are attributing much of this to social events and sports tournaments. That is why we must stay the course here at home. We must continue to be cautious, deliberate, and vigilant. We must continue to limit how and when we get together in larger numbers, even as we protect our borders and make testing part of our norm. Earlier this week, we also reported 2 additional cases of the UK variant of COVID-19. These cases were initially reported last month, and their samples were sent for variant testing at that time. The initial investigation did not determine a source for these infections. However, both cases are being re-examined, and retesting of all of their close contacts started yesterday. So we don't have results back yet, but we should be in a position to report more on this cluster next week. So this new information is, again, another clear reason why we need to continue to be cautious. We know that the UK variant can spread more easily. And the good news from these cases however, is that so far we have not seen any signs of community spread from these 2 variant cases. But we are, as I said, continuing to investigate. So with all this in mind, I'm asking that you continue to maintain the current public health protocols. Wash your hands, maintain a safe physical distance, wear your mask where required, and we're even encouraging you, even when it's not required, when you're in situations, whether they're in private situations or outdoor public places where you cannot maintain safe physical distance, we recommend you wear a mask even in those situations as well. Stay home if you're feeling unwell, and do the online self-assessment and get direction on testing. Keep your social circle small and introduce COVID testing as a regular part of your routine. And please follow the requirements of the public health order. Don't look for excuses, loopholes, or reasons not to follow. Do the right thing, use your common sense, and protect each other. Yesterday, we learned that the federal government is reallocating some of Canada's Moderna supply to our northern territories. While we know this is concerning to hear, we also understand the federal government's rationale. It is to address the complexities and unique challenges in our northern neighbors. And to do that, they need the support and cooperation of all provinces. So for Nova Scotia, this means that next week our shipment of Moderna will be reduced from 5,900 to 3,000 doses, and we are awaiting confirmation about our March shipment. However, we do anticipate some reduction in that shipment as well. Moderna is what we're using to vaccinate in our long-term care sector, and we know that this reduction will slow down our rollout of vaccine into our long-term care facilities. But it will not stop entirely, and it will not impact the administration of second doses when people become eligible. It's important to highlight that while this news does slow us down, that we have administered vaccine to 27 of our long-term care facilities to date, and our long-term care facilities remain protected by all our ongoing efforts that have us in such an enviable place epidemiologically. All along, our approach to vaccine has been strategic, flexible, and adaptable to either increases or decreases in vaccine supply. And this is what we will continue to do. And so we'll update you as we learn more about the Moderna situation and the impact on March shipments. Continuing vaccine, earlier this week I talked about the first prototype community clinic that will take place February 22nd to 26th at the IWK in Halifax. This clinic will immunize Nova Scotians who are 80 plus and older and who have been randomly selected by postal code, and it's a postal code that will have them living within an hour's distance of the IWK clinic. Those able to register for the clinic will receive a letter from Medivy, and I know some people have. We've already had people booking their initial appointments, or if they haven't received it, next week as well. And in that letter is all the details about the clinic and how to book appointments. Through the prototype clinics like this, we will learn a great deal about how to run different types of community clinics. And as I said before, doing this work puts us in the best position possible to roll out substantively increased or adapt to increased numbers of vaccine and roll out a large number of community clinics across the province. So I'd like to thank our partners with the Nova Scotia Health Authority and IWK who are working directly with this prototype clinic at the IWK, but also in all the detailed planning of our whole immunization program. We know that our strategy of testing, self-isolating, and contact tracing is working. We have seen that asymptomatic testing has played a key role in stopping COVID-19 from spreading in our communities. And this weekend, we will have several pop-up testing sites in Halifax, Kentville, and Digby. You can find out the specific time and exact location of these clinics on the Nova Scotia Health Authority website if you look under coronavirus testing. So as I mentioned earlier, introducing COVID testing as a regular part of your routine, especially during a long weekend when there's time with loved ones as part of either Valentine's Day or Heritage Day, is a great idea. So before closing, I want to take a moment to thank all our sports organizations for their tremendous work that is allowing athletes of all ages to play. Although we have made great strides, we need to remain vigilant in following return to sport protocols and following the key public health measures. It's important to remember that the public health guidelines are different depending on exactly what type of sport you're playing and how they're implemented. Within the sport field of play, whether it's a hockey arena, a basketball court, the gathering limit is up to 60 without physical distancing. However, once the play is done, the rules change. So, for example, following a soccer game, a team of 18 people cannot enter a restaurant and all sit together. The limit per table even within that team is 10. Or following, we've got examples of this, a regular hockey league game, maybe a team has traveled, they're staying overnight in a hotel. Even though they just played a game together, there are limits on the number of people who can gather in the pool or in a common space in the hotel, and that number is 10. So I know the numbers are different, but there's different reasons behind them. So please be aware of the different gathering limits and follow them as you're required. And I thank people for their ongoing efforts and cooperation. And lastly, Sunday is Valentine's Day. During this pandemic, I'm not sure what better way to demonstrate how much you care for your loved ones in your community than by following public health guidance that will keep everyone safe. I know that's not something you'll find on a Valentine's Day card, or I couldn't find a rhyme for it, but I think it's an important message for anyone looking to celebrate this weekend. We show each other how much we care for each other and love each other by doing the things necessary, continuing to do the things necessary that keep each other safe, as an example for the rest of Canada, right here in Nova Scotia. The Monday is Heritage Day as well, and for those that will be fortunate to have the day off, I hope you're able to spend some quality time with family or within your small, safe social circle. And we'll see you back here next week. Premier.
Happy Valentine's Day.
Happy Valentine's Day to you.
I just want to reaffirm something Dr. Strang had talked about. You'll remember back in December when we talked about rolling out the vaccine, and the Pfizer vaccine, it was its first shipments into Canada. It was made clear that Pfizer vaccine would not be used in northern Canada because of the requirements at keeping it at -70. And it was agreed by provinces that the Moderna vaccine, when it started to come in, would be used to help deal with the issue of supply in Northern Canada, and it really is being shipped on a per capita basis, but in Northern Canada, the only one used is Moderna, and that was talked about way back in December. So this is not something unexpected, and I want to thank Public Health from the very beginning, who continued to and has continued to put a variety of ways for us to be able to deliver this vaccine when we receive it, and it allows us to deal with any of the issues if supply slows down or increases, to be able to make sure we get in the arms of Nova Scotians. So thank all your colleagues.
I will, Premier, and an increase would be nice.
Yeah, that's right.
Premier, we'll take one question and one follow-up in the amount of time that we have for today. First question will go to Canadian Press, Keith Doucette.
Good afternoon, gentlemen. Dr. Strang, I'm wondering what lessons we are drawing from the current outbreak in St. John's, given how we're seeing this spread very rapidly amid the younger population there.
Yeah, well, I mean, as I said, it's the first lesson is how quickly things can change, and that you right now, while we're in the middle of the second wave with variants, we cannot become complacent. We need to stay very cautious. The other lesson is, as I've talked with Dr. Fitzgerald over the last few days, and what they're saying publicly, they're attributing a lot of this major outbreak in St. John's to social gatherings and sports tournaments. They had one very large volleyball tournament that brought high school teams from across St. John's all together. So again, as I said in my remarks, it's a reminder that why we continue to work really hard, and while we've opened up a number of things, we put limitations on the number of people that can gather together. We've allowed sports, but we're not allowing tournaments. Frankly, listening to and hearing what's happening in Newfoundland to me tells us that we are on the right path, that we continue to limit all these types of gatherings as a key way to put us in the best possible position.
Go ahead with your follow-up, Keith.
Yeah, along those lines, despite what you just said, are you considering what's going on in St. John's? Are you looking at any preemptive actions around schools or gatherings involving younger people? Now that we know that we may even have virus variants in the mix as well.
So I think our first protection is our measures at our border. As I said, and we will continue to look at how we can make those as efficient, and the compliance and the monitoring, continue to work and improve those. That's the key piece, which limits the chance of virus getting in here in the first place. Then I think the investments we've made in comprehensive testing. I'll be honest, part of what we're seeing in St. John is they weren't testing lots of people, and now they all of a sudden they've got 2 or 3 weeks worth of people that they now have to test. We're in a different position because of our investment and our innovation in the ways we're using asymptomatic testing, continuing to stay ahead of the virus, which allows us then to be in a position to, when we do have cases, we're well within the public health capacity that we respond very quickly and comprehensively. The team that's now in place of revisiting all these the 2 variant cases, retesting all the contacts. We have the ability to do that very quickly because we have the capacity. So that puts us in a position where we have opened some gatherings up, but we still have limitations of how many people can get together. Our schools are open and they remain safe. So I think all those other layers allow us to be in a position where we can open things up to a certain extent. But again, St. John's is a reminder that we don't want to go too far. So that is why, as I said, we've allowed sports, but we've said teams that only play on a regular basis. We do not want teams getting together from across the province at a big tournament. And so we're not allowing that. That's just too risky. So it's all, I think, again, your answer, looking at St. John's, reminds us and shows us that we're making good decisions here in Nova Scotia to keep ourselves as safe as possible.
Next question will go to Jean Laroche with CBC.
Good afternoon, Dr. Strang. It's prescient that you talked about our first protection at the border because, as you know, or you may know, the Prime Minister has just announced that Canadians returning from abroad will have to quarantine 3 days in a hotel starting February 22nd. I'm just wondering, given the incubation period of COVID-19, how much of an actual protection is it that Canadians would have to spend 3 days in a hotel and then be sent home to quarantine if they get a positive PCR test?
So no, if they get a positive, they're going to be staying isolated in that community, in that hotel or that city where they come into the country. If they're negative, remember they have to have a negative test before they leave their destination. They're tested again, and if they have a quarantine within those 4 cities where the international plane arrivals, if their second test is negative, then they can move on and come home to Nova Scotia, but they will have to continue the remaining 11 days of their quarantine. It's not like they're out of quarantine. But I think it's a good step by the federal government to require those 2 tests, one before, one on arrival, and not allow them to move on until they've had clearly they've had to have had 2 recent negative tests before they can move on, which gives a great, a significant amount of reassurance, not 100%, but a significant amount of reassurance that they actually don't have COVID, and then they have to finish off their quarantine. And the feds have also said that they're going to increase their efforts to monitor the people who are under quarantine, and we're continue to have discussions with the federal government around the details of that last piece.
Go ahead with your follow-up, Sean.
Good catch, Dr. Strang. I did mean that a negative test. On the vaccine front, the Prime Minister also mentioned that the federal government has ordered and will receive $4 million doses. My apologies, of the Pfizer vaccine over and above what's been ordered by the end of March. What's that likely to do, if anything, to our vaccination program as we move forward?
So we don't have firm, confirmed numbers yet from our federal colleagues. I mean, we were informed of this yesterday as well, and certainly we're anticipating that the amount of Pfizer vaccine that we can start to plan around is going to substantially increase as we move in the weeks ahead. But we have to be a little bit careful, because until we get actual confirmed numbers, we don't want to be, I guess we don't want to count our chickens before the eggs hatch. I'm getting it all mixed up, but being careful. It's good news, but we don't have absolute guarantee of those amounts. So we'll plan for it and be ready to get whatever vaccine we get.
Almost 12 months you're allowed to get that.
Next question will go to CTV, Natasha Pace.
Thank you. Premier, Manitoba has made a deal to buy 2 million doses of a Canadian-made COVID vaccine. I'm wondering if Nova Scotia is looking at potentially doing this. Why or why not?
We're going to follow the guidelines of Public Health Canada to make sure that vaccine gets approved, and when any vaccine is approved, we'll continue to work with our colleagues at Public Health to purchase it.
Yeah, maybe I'll make an extra comment. I was surprised to hear Manitoba do that. I mean, all our vaccines, we go through a common procurement process that is led by the federal government, including the COVID vaccine. So we also know that if there's a domestic supply of vaccine is many months down the road. So certainly in the short to medium term, we are not going to at all be able to count on any domestically produced vaccine.
Go ahead with your follow-up, Natasha.
Okay. Wondering as well, with the 3 variants, 3 UK variants confirmed now in Nova Scotia and the 1 South African variant, is there anything additional Nova Scotians need to do to try to prevent the spread of this?
We've had lots of discussions of this with my team, with national tables and looking at the international evidence. The variants don't require anything different. It just means you have to be extra cautious and be more vigilant in our existing public health measures. And one of the key ones for us is making sure we're very careful at our borders, minimizing the chance of virus, no matter what variant it is or what strain it is, getting in here into the province in the first place.
Next question will go to Jesse Thomas with Global.
Thank you. I hate to burn a question on numbers, Dr. Strang, but I'm just wondering if you can kind of clarify some of the vaccine doses. I think on Tuesday you said we're prepared to get 8,775 doses of Pfizer. That's kind of our largest one-time shipment. But then earlier today you referenced Moderna vaccine, about 5,900 doses that'll come in, but part of that's being affected. Can you just look at your numbers and give us an indication of what's coming down the pipeline next week for us?
So what I know is that what you just articulated, almost 9,000 doses of Pfizer vaccine, the biggest weekly shipment we've got, and we know now that the amount of Moderna we're going to get is now reduced down to 3,000.
Follow up, Jesse?
I guess with that reduction, you kind of hinted at it. It's going to impact the long-term care supply. How much of a concern is that right now in the short term, given that it sounds like maybe the Pfizer will start to pick up?
Yeah, and so we're going to get more Pfizer. We're also looking at, could we use Pfizer in long-term care? Because of its more stricter temperature requirements, it's more problematic, but we are actively looking at that. Less Moderna means we just have to go a little bit slower in our long-term care immunizations. It's not ideal, but that's a reality, and we also completely understand that making some accommodations for our northern territories and their unique nature is necessary, as us being part of the country and helping where necessary other Canadians out.
Next question will go to Lindsay Armstrong with All Nova Scotia.
Thank you very much. Dr. Strang, during yesterday's COVID briefing in New Brunswick, Dr. Russell said that those who are suspected of potentially having a variant case of COVID are being asked to extend their quarantine to 21 days until their cases can be reviewed by the national lab. I'm wondering what precautions Nova Scotia is taking for those who are suspected to have a variant case.
So if we, first of all, because of right now, we won't get information on the variant strain for a number of weeks. So it's a good example. The cases we had, they were the third week in January when we identified them. We sent that information off, and now here it is, almost the middle of February before we're getting the results back. So we don't base any of our public health actions at the time, based on whether somebody has a variant or not, because we won't have that information. I'm not quite sure I understand New Brunswick extending to 21 days. Because there's no indication that whether you're a variant strain or not, that you're actually infectious beyond the 10 day from the 10 days from the time either you were diagnosed or the time that you develop symptoms and your symptoms have resolved. So if somebody's positive, we will, whether they're once they've reached the criteria for being a resolved case, they can be removed from isolation. They may be referring to what and Alberta did the same thing. It appears like it's an increase in quarantine, but what it means is simply that if contacts, they have to make sure that the contact is isolated for 14 days beyond the last time they would have been in contact with the case. So that could, that may extend their period of time. And we are looking at how we test all our contacts. We're now actively looking at when we have contacts of cases of travel, which all our cases are, higher risk for variant strain. We're going to be testing those contacts multiple times throughout their 14-day quarantine period.
Go ahead with your follow-up, Lindsay.
Thank you for that, Dr. Strang. And once again, moving back to the Moderna shipment reductions, I'm wondering, we say, this will slow down our long-term care rollout. Is that looking like a delay of a couple weeks? What type of slowdown is this?
So, we're only getting Moderna every 3 weeks. So, as I said, we got a reduction by close to half in the next week, and we anticipate getting some reduction. We're not sure much now in March. It just means that we adjust our programmatic schedule, and we immunize fewer people throughout that time. But as I said, we're also looking at the possibility of supplementing the Moderna with some Pfizer vaccine in long-term care as well. That has its own challenges, as I said, because of the stricter temperature requirements. But people are looking at that.
Next question will go to John McPhee with the Herald.
Thank you. This would be for Dr. Strang, I guess. Given the big spike in case numbers yesterday in Newfoundland, are there worries that infected people could have come across the border before it was shut down? Have we been in touch with the ferry service, any kind of tracking of possible cases there?
So we would not have a way to track people who had come to Newfoundland prior to us putting the quarantine period on, because they wouldn't have been required to register or use our safe check-in form, so we'd have no idea who they are. But what we have, we continue to message in our media releases, as I talked about at the briefing on Tuesday, that anybody who's come here from Newfoundland in the last 2 weeks, we ask them that they should go and get tested. If you're a Nova Scotian, but you've had people visiting you from Newfoundland, you also should go and get tested. If you're one of the people that is visiting from Newfoundland, you need to, once you've been tested, you need to isolate. If you're just a Nova Scotian who's had a Newfoundland visitor, and then you're going to go get tested, you yourself don't have to isolate. So we are encouraging anybody who's come from or been in close contact with somebody from Newfoundland in the last 2 weeks to go and get tested.
Go ahead with your follow-up, John.
Thank you. Regarding the prototype vaccination clinic on the 22nd for people 80 and over, we've heard concerns that getting a parking spot at the IWK might be a challenge, given that it's pretty tight there at the best of times, and you're going to have about 500 people or so over 3 to 4 days. I'm just wondering if any measures have been taken to expand access to parking there for that event.
That's a level of detail that I haven't been involved in, but I'll certainly take that back and ask the team planning this clinic about that.
Next question will go to Tim Biscay with the Halifax Examiner.
Hi, Dr. Strang. I'm wondering if you could just expand a little bit on the recent variant cases. I understood you to say that there was no evidence that those people infected anyone else, but did I hear you right that it wasn't, that you don't know how they became infected? Because every day, I mean, we haven't been told that there was community spread, but that seems to be the definition of community spread, no?
So one of the case, we don't have a clear where they were, or for the 2 cases, we don't have a clear indication where their source originated from. It's one of them transmitted to the other one in all likelihood, but we can't rule out for sure that they didn't each have a common source. The concern is that could they have been exposed in the community, but we're seeing no signs anywhere else, even through our asymptomatic testing, that we've missed something. So it may well be that and this is why we're re-interviewing them, that there was a source related to travel that we're just not aware of. We haven't been able to uncover yet, but we're actively looking at that. Those 2 cases had a number of close contacts, all of who were initially tested and isolated. They were all negative, but because of the concern around the variants, we're going back and retesting all those close contacts, and they have to re-isolate until they get back a negative test. And because there was a couple of community exposures around these cases, that's why we've reissued the community notification, and there's 2 specific locations, and that we're asking anybody who was at those locations at the appropriate time and place, even if they have already been tested, to go back and be retested. So we're using this retesting to be extra careful around that, to make sure we haven't missed anything. But I have to reiterate that if you look around the world, and even in Canada, when the variant shows up, it's very obvious in terms of large numbers of people spreading very rapidly. We are not seeing that, and we have lots of asymptomatic testing, lots of ways we're monitoring things, and we're not seeing any sign of it at this point in time, which is reassuring. But we absolutely have to pay close attention, and that's why we've reopened this case and redoing a lot of the investigation and retesting lots of folks.
Go ahead with your follow-up, Tim.
Yeah, specific to the recent possible exposure notifications, one in New Minas at the Walmart and one the other day at Sobeys in Dartmouth. We read the reports every day, and you tell us that all the new cases recently are travel, and we read the reports that people are self-isolating and have been self-isolating. So why are there these potential exposures?
So we have some people who, because of their essential nature of their work, and I'll use long-distance truck drivers as an example, that they are exempted under the order. They do not have to quarantine when they come back into the province. And we've had cases where they're doing what they are allowed to do, but then they test and they test positive. And because of that, then they generate a community, potentially generate a community notification. So it wasn't like they were doing anything wrong, but we have to make these accommodations for people that are essential to the movement of people and goods in and out of Nova Scotia.
Next question will go to Daryl Roberts with The Signal.
Thank you. My question is for Dr. Strang. I'm wondering how this shortage in the Moderna vaccine will affect the overall general rollout.
So as I said, it'll slow down our delivery of vaccine in the long-term care facilities for the next few weeks. We continue to look at all the reassurances that our 90-day supply what we've been promised initially, we will get that. And then as we move beyond that into April and May, continue to be reassured that the increased amounts of vaccine that we expected to get will be there. So even though we've had short-term delays in Pfizer, and we're now getting lots of, again, as I said earlier, not confirmed, but lots of positive signals that the Pfizer production is picking up and will make up those delays. We've got some short-term delays in Moderna. Some of it is production, but then some of it is a necessary allocation within the province. But we fully expect we're going to get all the vaccine that we need to get and more in the weeks and months to come.
Go ahead with your follow-up, Daryl.
Thank you. So we've been seeing some easing of restrictions in recent weeks as a result of the relatively low number of cases that we've had here. But bars and restaurants are still required to close by 11 p.m. So I'm wondering if there's been any discussions about potentially extending these operating hours.
Not at this point in time. That's an area, as I explained when we opened up the gatherings, we need to be extra careful about, environments where people are together for a prolonged period of time, in close contact with each other, often, not wearing masks because they're eating and drinking. And then when you add alcohol and other impairing substances into the mix, people's judgment wanes. Those are high-risk environments. Just look at the epidemiology. So while we've opened up lots of other gatherings, we have to maintain a much greater control over what I call the later night social events, which are much higher risk. So as part of our slow, cautious approach, if we can stay another month or more, we can maybe look at that. But right now, it would be too risky to open up bars and restaurants with extended hours. We've just now opened up a number of other types of gatherings.
And that's all the time we have for questions today. Thanks.
Thank you, Chrissy. A long weekend is upon us, and it's Valentine's Day to boot. I know a lot of you have been cooped up inside and are wanting to get outside. And I'm sure you lovebirds want to celebrate with a romantic dinner, and all you singles might want to get together to mix and mingle. Remember, as you try to spread the love, don't forget, COVID wants to be your Cupid. Don't let your guard down, and even if you are all aflutter with romance, follow the protocols. If you are in a restaurant, no more than 10 at your table. If you go to a house gathering, no more than 10. Keep your distance from outside of your own group. Don't forget to wear your mask and keep washing your hands. It's a long weekend and everyone deserves some rest, relaxation, and fun, but not at the risk of letting COVID in. I'm really proud of all of you and your hard work, your steadfast commitment to keeping COVID at bay. But we can't forget, COVID is always lurking and waiting for us to make a mistake. So in this long weekend, and yes, on Valentine's Day, let's show each other the love by loving each other from a distance. Have a great long weekend, and we will see you here next week.